I'm Tobias Kohler. I'm a men's health surgeon at the Mayo Clinic in Rochester, and I love being a urologist.
I heard that Mayo Clinic has always been rated the top, medical center in the U.S. for a very long time. Why?
It's a good question. Part of it's luck, like everything else in life. But my explanation, this may or may not be correct, but my understanding of why we've been so successful is that when Mayo was first kind of founded, they had some unique principles that resonated with a lot of the physicians that they attracted. So the number one saying at Mayo is the needs of the patient come first.
Sure.
And so it's a very patient-centric system.
Okay.
And if you keep that as your number one tenet, and other ways to think about this is like, how would you treat your family members? That's how all patients should be treated. How would you treat the celebrity?
Sure.
That's how all patients should be treated. So it should be the same regardless. And then if you set up an infrastructure which supports that philosophy, you're going to have more success. So at Mayo Clinic, we're all salaried. Okay, so we make the same money whether we do 10 surgeries or 100 surgeries. What does that translate to? That means that there's no incentive for me to offer you a surgery if you don't need it. There are economic pressures all over the world for doctors to perform a certain number of cases. That should not be in the equation when you're giving medical advice. So, I mean, just at the end of the day, you have the luxury of giving the best advice. And if the patient needs what you offer, great. If they don't, they shouldn't get a surgery. So that's one thing. The other thing is, again, early on, Mayo Clinic was very good of sharing information and bringing in the world experts to learn from one another. So I've learned so much from you today, watching you do a case. It made me think about things I've never thought about doing. And we can all learn from each other for certain, but you did a great surgery today, and I'm going to take some things back with me. But that spirit of collegiality and humility is contagious and infectious. You start to accumulate these world experts at a medical center, and it becomes easier for the next great person who's great in his or her field to come there. All of a sudden, you get this all-star team because people want to join the winning team. Sure. It's like the Bayern Munich or New York Yankees of the world, and that's a big part of it too. So we were lucky in that we were very good early, and we fought very hard to maintain that reputation by hiring hopefully the best and the brightest, and then keeping the doctors and the nurses and everybody who works there happy, so that you have this team approach and it can build on itself.
Every time I have an interview with the successful surgeons, one of the common things they comment, once the doctors stop learning, is the moment they will die. And I totally agree with them. Literatures are just flooding these days, and the new advanced technology in terms of the science and the medical devices, drugs, and all those aspects, we have to keep up ourselves. Otherwise, we can't really provide them state-of-the-art service. The other part I really appreciate from you is that what I really repeatedly saw, successful surgeons, they will never sell their surgery to their patient. It is a very important point. Again, I totally agree with you. There's an economic pressure everywhere. But still, when it comes to medical business, ethicality is a top priority for us to serve them as like my family. If he's my brother, if he's my father, will I offer the surgery to him? That is a fundamental question we need to have.
Yep. I feel very lucky to be there, honored. And the other thing that I'd say, advice that I think about is, if you were uncomfortable with what you did being on the front page of the newspaper the next day, you shouldn't be doing that, right? So think about the repercussions of your actions. And, I got to be able to sleep at night. If you do the right thing, that's never a problem.
As a president-elect of the SMSNA, what are you going to do to help better educating upcoming surgeons?
After COVID, we spent a lot of time apart. And the amount of training that we could do and the teaching that we could provide for one another went way down. We're going to do a lot of workshops internationally, whether it's here in Korea or Vietnam or Venezuela, you name it. Any place that wants to learn kind of state-of-the-art surgical techniques, we're going to try to provide those resources. The other thing that we're doing in the U.S. is we're focusing on unique training programs. Dr. Mohit Khera is a great friend of mine. He's the current president of the SMSNA. And he came with this idea to have the surgical boot camp. So now all of the andrology fellows, the men's health specialty fellows will do, at the beginning of their year, they'll spend, or remember, 3-4 days in Minnesota visiting the implant companies.
All right.
And there will be a curriculum given by a bunch of the SMSNA members in coordination with the companies. And then we'll bring them back a year later. We'll give the same course, and then they will become a mentor for the next class. So this is the first year. So we'll have 30 fellows, and the next year we'll have 60 fellows. The ones who are 1 year in. So hopefully they'll pair up this mentor-mentee relationship. We've had a lot of success historically with cadaver labs, but it always ends up being a very brief couple hours of one very focused topic. So our concept is to do a cadaver lab for implants, but then the next day to do a cadaver lab for sphincters, and then have the BPH lectures, prostate problems, or Peyronie's disease. So all these companies, we're going to collaborate to make an excellent experience over a short few days. So it's very highly intense, so that when those fellows go back to do their fellowship, hopefully they're a little bit more prepared and more on even ground, depending on where they're doing their fellowship. And then they'll come back a year later, hopefully having learned a lot. And then the other plan is to really get feedback from them. It's like, what do you need? Where do you feel deficient? Kind of ask what they feel most uncomfortable with to try to solve those issues.
Because the reason why I asked you is that Korean Sexual Medicine Society appointed me as an executive director on prosthetics. It's a newly created job. For the past 35 years, there was no anyone who should deal with the prosthetics, but they wanted me to do the job. And the other thing they wanted me to do is to think about the surgeon training. I traveled quite around the world, but in my eyes, US was doing the best surgeon training, fellowship training, resident training in terms of the prosthetics. That is the reason why I want to learn from the US how they train the new surgeons. Because being a good surgeon and being a good trainer, as you know, is a different skill set, a completely different ballgame. So I wanted to learn how the US does so that I can modify it and apply it to the Korean culture. Same thing, I believe, should happen in the Asian continent as well. As their economic status gets better, they have a huge demand for sexual medicine, health. But there's not many who can support that as a medical provider. So
yeah, it's funny. We become surgeons, and nobody ever taught us how to teach. It's just like an expectation. But like everything else in life, there are good teachers and bad teachers.
Correct.
And the good teachers use certain tricks that are learnable. If you have a few things you can do, you can immediately become a better teacher. Part of it is to be a flexible human, because some people learn well some way, other people learn well the other ways. You have to try to appreciate that. Part of I think a problem with surgical training around the world is that we don't teach people how to become good teachers. And again, if we get good at something, we're much more likely to do it. So if somebody says, Sean Park, you are an amazing implant instructor, and people give you an award for that, you're going to do more teaching. You're going to look for those opportunities. So that's what we have to encourage.
This was a question in regard of your training importance. So patients are coming to you. They come to the Mayo Clinic, to Tobias Kohler, not for the residents or the fellows, but at the same time, you have to train the fellows and residents as well. So how do you balance the quality of service at the same time train the residents and fellows who are not as skillful or as experienced as yourself?
It's like anything else. I like the pilot example. Like a new pilot just doesn't get to fly the jumbo jet with 600 passengers on it, right? They go to the simulator, and then they do some written work, and then they're the co-pilot. And eventually they have what we call graduated responsibility, and then one day they're ready. And some residents are ready after 15 cases for a certain procedure. Some take 50. As teachers, we have to recognize the strengths and weaknesses of our learners and steer them in the right direction. Sometimes that means, you shouldn't be a surgeon. Most of the time, though, the trainees will do well and they'll become excellent at the surgery. It's interesting. If I go to the doctor, if I get a procedure, it's not in my best interest to tell them I'm a surgeon or I'm a doctor. Because studies have shown that if you tell them that you're a doctor, they will get out of their routine. And when people leave their routine, that's when mistakes happen. When you go to a place like Mayo Clinic or you go to your clinic, you've had amazing outcomes. And so you have to trust that process and let you do how you do it best. And if that involves a trainee, so be it. Again, I would rather have 2 sets of eyes and 2 sets of hands that are experienced doing the surgery than just me alone, because I'm not perfect. But together we can kind of protect each other from doing something crazy. Or if we need a second opinion, we can talk about what we should do. The other thing I tell my trainees is never hesitate to bring in a third surgeon. You know, sometimes you're in the heat of the battle, and if things aren't going well, having a fresh perspective is very, very important. So sometimes I'll call somebody in the operating room. I'll call Dr. Wilson. I know what he's going to tell me, but he gives me the courage to do the right thing sometimes. Sometimes the right thing is actually stopping the surgery for that day and coming back at different times. And you know, it's interesting because patients have an expectation that you are kind of don't have any weaknesses or you're the world's best at these things, but everybody's human. And so the system is set up in such a way that we have great success because we have a team-based approach. And I honestly believe I do a better job with a trainee than by myself. And if you make me go out of my routine, that's more likely something's going to go wrong. The other thing is, you know, patients often expect to have doctors have all the answers. And as I was training, when I went from residency to fellowship, I thought, okay, now I'm going to get the book, the secret book, with all the answers to all the fellowship type of questions. And there is no book. So again, the more I learn that we don't know as much as we think we do.
Yes.
And you have to be humble. And this means sometimes, you know, we can't help. There are certain conditions where we can't make it better, but we can do our best. And if patients come in with that type of expectations, more realistic, they're going to have better success too. My favorite saying for patients before surgery, for surgeons to tell their patients is, I under-promise, over-deliver. Another way to approach counseling patients about surgery is to give a best case, worst case, most likely case scenario. And it could go amazing, very little pain, and you're using the implant in 2 weeks. Or it could go horribly. You could get an infection, you have to take it out. But the most likely thing that happens is you're going to not like me very much for a few weeks because there's a little bit uncomfortable. And then at 6 weeks, I'm your best friend again because it's working and you're using it, right? In my other job, my consent was obtained by somebody else, by the nurse before. Now my pre-op discussion at Mayo, me and the patient for 20, 30 minutes, making sure all their questions are answered. And also, you know, you have this beautiful video library that patients can take advantage of. I really encourage, and I have the same thing in my practice, if the patients watch that ahead of time, that pre-op discussion is so rewarding for me because they already know what to expect, and then they ask me sophisticated questions, and that's great. And then the patient will also have much more realistic expectations of what will and can happen.
I think one word could summarize what you said: transparency. Absolute transparency with your patient. And that became my principle as well. I have to tell them I'm just a human being. I tell them I'm no God. I can make mistake, but I'll try my best not to make. It's a quite interesting thing, you know. The humble we become, actually, the more confident. Confidence and arrogance has a very vague line. Being humble, I believe, is the key point. And all throughout our courses yesterday, today, your humbleness toward the medicine, the field itself, kind of amazed me. You are such an accomplished surgeon. Even so, I couldn't sense any single arrogance or any sense of ego.
Well, I appreciate that. And, you know, I have a joke that, you know, the more surgery you do, the more complications you have. And so then you get beaten with a humility stick. They will beat that arrogance out of you. And when you realize, you know, I did my best and, you know, it wasn't good enough. I want to finish the sentence. You say, you know, I'm not perfect and I'll do my best for you. The next part of the phrase is, and if anything goes wrong, we will keep fighting together. As long as you want to keep going and try to fix what happened, we'll do so. And I think that's all a patient can ask for.
Different questions. Do you like to drive?
Do I like to drive?
Drive a car?
Sure.
Okay. The next question is, do you like to cook?
I like to eat my wife's cooking. I like to order food, which other people have cooked. Yeah, so I like to drive more than I like to cook. Let's put it that way.
The reason why I asked you is that, you know, I've been interviewing several surgeons around the world. At least they like either cooking or driving, or both.
Really?
This was a wisdom from my friend, the pathologist. So he said, I love cooking, I love driving. My pathology friend says, of course you are, because you are a surgeon. What does it have to do with being a surgeon? He told me back that surgeons like to be in charge of your situation. Because most of the surgeons prefer to
Run the show.
Yeah. They kind of have an obsession, an obsessive compulsive, enthusiasm toward what they are doing. So to make the surgery, I would say, perfect.
I would say that too much control leaves little room for flexibility and innovation. So sure, when I'm supervising surgery, it's always safe. But if the learner wants to try something new, the first question is why? Why do you think this is better? And if they convince me, I'll switch. As a matter of fact, how I do my vasectomies is different because a resident said, well, why don't we do it this way? I say, I have no idea. We should do it that way. And I forever changed how I did my surgery. So I think it's good to also have a kind of an open heart and be willing to learn something new.
Here's some interesting question. I watched you and your early teenage daughter get along so well, which is a very rare thing. I think that's the secret of it is a communication. Can you share me any secret you have in terms of the communication?
I think some good advice is to listen more than talk. Try to understand the perspective. But, I can't take all the credit. Luckily, my daughters take after my wife. And so they're very understanding. They put up with my nonsense, And again, I don't take myself too seriously. I try to laugh. But yeah, I think if you do your best, that goes a long way.
I think that is the reason why you became a good teacher as well. Like a good surgeon understand what the patient needs, good teacher will understand what trainees need, and as a good parent, you understood what your children need. So great talking to you, and looking forward to see you in Mayo Clinic.
Absolutely. We're certainly going to invite you there. So you've done an amazing job of building an amazing practice here. You've taken risks to develop this surgical skill set, and you're thriving now. So congratulations to everything you've done.
Thank you. And thank you for the amazing interview.